I'm sort of withdrawing from my various roles. I um I like to say that I work 60% time. I actually work full time. I'm paid 60% time. You know how that goes. And the good part of that is I get to do the stuff that I really like to do. And those are the things like teaching. I'm still writing papers. Um, I take part in some longitudinal research with people in psychology. Um, Catherine Gallanter is our new division director, who's starting today. You'll be happy to hear. Um, and um, and I guess the other role I feel like I have is doing things like this to kind of help along the younger generation. I think, when you get to be a certain age, you're like a mother and a grandmother in your profession, and those are the kinds of things that you do. I'm still a wife and mother, by the way. You never stop being those, even when your kids are bigger than you are, and older than you are, right? My kids are all older than I am. So when I was in medical school, I had several interests, one of which was psychiatry, and one of which was hematology oncology. I had a wonderful mentor in hemonc, and so I was really interested in that. And I was interested in psychiatry because it's an interesting area. I was at Cornell at the time, and it was at a time when psychoanalytic theory was the main theory that there was. And I can't say I had enough brains to know one theory from the next. But if you know me at all, and we don't know each other that well, but if you know me at all, you know I talk a lot. And one of the things that I learned in that psychiatry elective was that I couldn't keep my mouth shut long enough to be a good psychodynamic psychotherapist. On the other hand, I enjoyed medicine, I enjoyed problem solving, I enjoyed relating to the kids. I was on a children's unit. And so at the end of that time, I decided I would do a medicine internship. Um, it was around October of my internship year when had seen just about as many young women with abdominal pain as I care to see, most of whom I thought had psychological problems. I said, maybe I should revisit psychiatry again. So we were at Washington University in St. Louis, and I was at Jewish Hospital, and it was right across the street from Barnes, where they had their residency program. And I trotted over to see a guy named George Winokur, who was the head of training at the time. And George was a soulmate for me. He was short, he had a great sense of humor and great laugh, and he thought about psychiatry in the same way I thought about hematology oncology, as a problem solving, as a mystery. You're trying to solve a mystery kind of a thing. And so I said, I can do that. And so that's kind of how I ended up in psychiatry. And in terms of child psychiatry, it was a little bit of the same thing. I spent a year at NIMH on the affective disorders unit with Fred Goodwin, who was a star in the area. And I had a young man who I actually talked about in my talk in the presidential initiative when I had that talk. Young man who was admitted to the hospital with what I thought was a manic episode. Everybody else thought he had schizophrenia. And I said, if he were 40, you'd give him a diagnosis of mania. Just because he's young, you're saying that's not what he has. So I got interested in the whole idea of developmental psychopathology. What does age and development do to psychopathology and treatment and so forth? And what happens with families and outcome. So that kind of got me interested in doing a fellowship in child psychiatry. When I got into child psychiatry, I started because I wanted to know developmental psychopathology. I really hadn't planned on being a child psychiatrist, I hadn't thought about it one way or the other. But that wasn't why I wanted to be a child psychiatrist. But when I got there, was sort of like psychiatry. When I got there, the kids were so cute. I mean, they're just so much fun. So two of my favorite kids, one of them, um, and in the one of my therapy, when I was about 30, I was prematurely gray, I had a gray forelock and gray sideburns. I don't have them anymore, of course, but I had them then. And he says to me, "You must be old, Dr. Carlson. You've got gray hair." And I said, "If you want to live to see your next birthday, you won't say that to a woman." And he says, he regroups almost immediately. And then he says, "But actually, you couldn't be too old because you don't have those lines around your eyes." And the other kid that I remember was kind of cute. Um, he was, I don't know, 6 or 7, something like that. I was in Missouri at the time. And he was sullen and grouchy and I'm sort of 10 minutes into the interview trying to make a relationship with this kid, and he just wasn't having any. And so I said, "What is bugging you? I don't even know you. Why are you being so rude?" And he says, "My mother said I was going to see a child psychiatrist, and you ain't no child." I basically have been pretty well associated with ACAP, a little bit APA, but not American Psychopathological Association, International Psychiatry and Research, and Child and Adolescent Psychiatry. So sort of more of those kinds of organizations. But in terms of large organizations that are place that are guild organizations, ACAP has been my home. And how did I get there? Um, I have to say, largely I got there because of the staff. Um, I have rarely worked with such decent, nice people. Back when I was giving, I don't know, some presentations, we were in Florida, whatever it was, and I got there and my secretary had forgotten to book a room for me. And I was in panic mode. I wasn't anybody at the time. It was just a presenter, right? I'd presented before, but I was just a presenter. And by God, Heidi, who at the time was the meetings manager or director or whatever, got me a room. I mean, you don't forget stuff like that, right? Um, when I was, so Larry Greenhill was president, and the position of program chair got vacant. He and I had worked together for, I don't know, at least a decade, doing the Psychopharm Institute, the January Psychopharm Institute, usually in New York or sometimes Los Angeles. And so he asked me if I would be interested in being program chair. Well, I was flattered out of my mind. Um, I hadn't even been on the program committee before. But again, the staff was very helpful and provided the kind of mentorship I needed. Certainly the child psychiatrist did too. But I have to say the staff cushioned the blows for me. And I think when I was finished being program chair, I said, you know what, this is a really nice organization. I would like to continue working with this organization. And I'm kind of interested in leadership. And so I went to Marty Drell, who must have been president at the time, and I said, "Marty, what's your advice on this? What do you think? You know me a little bit, not that well, but you know me a little bit. And what would you advise?" And he said, "Why don't you consider being president?" And I went, "What?" And right. And so I said, "Well, okay, I'm not sure what the president does or what the secretary does or what the treasurer does." He says, "Well, really, you ought to be in council. I mean, council really will let you know more of what the organization does and who's on it and so forth and so on. Why don't you be in council?" So I did, and I ran for it, and I got elected for it, and I was there for several years. Um, and at the end of that time, it was the same kind of thing. I said, gee, I really like working with this organization. I don't want to say goodbye. And so that was the point at which I made the decision to run for president, in part because I'm crappy with numbers, and so I would not have made a good treasurer. And I'm not, I'm a well-organized person, but I'm not a detail person. And I think the secretary has to be a detail person. So that left president. So again, it's one of those you back into it kind of things. And I, having watched Karen Wagner, who was my president for while I was president-elect, she was, you know, very helpful and wise and all of those things that Karen is. And so that was how I ended up being president. Having backed into a number of things, one of the things I actually backed into was academia. When I was a fellow, I didn't know anything about research and grants. And so my mentor, Denny Cantwell, said, we need to write a grant. Okay, basically a K award. So, oh, okay, well, I did that and we got it. And it was my first study of depression and so forth. And I wrote papers. I actually took off a couple of years because I had my older son. And so I only worked half time. And so I was able to get some papers written. And at a certain point, somebody said to me, you know, you ought to go up for tenure. And I said, what's that? Okay. And so the guy's name was Steve Forness. He wasn't even a child psychiatrist. He was a special education professor. And he was the one that put me up for it and sort of guided me through it and, you know, toweled me off and pushed me into it. I had no idea what you were supposed to do with stuff like that. So I think that there have been people who have looked out for me over the years, and I'm eternally grateful to them. I mean, I don't know if I can draw a big line between mentorship and sponsorship, but you know, mentors don't necessarily put you out there and sponsors do. And I think that that has been a really important role. Understanding children who have outbursts or meltdowns or whatever sort of grows out of my interest in bipolar disorder. That was the disorder that got me into psychiatry and child psychiatry. The young man with a manic episode that people said, oh, young people can't have manic episodes. So, you know, I think we didn't have that much trouble proving that adolescents can have bipolar disorder. The whole business about childhood bipolar disorder is a different set of arguments, in my opinion. And a lot of those arguments were around children who have explosive outbursts. And so those are the kinds of kids that inhabited my inpatient unit. And I've sort of overseen inpatient units for my entire career. Those are the kids that come into emergency rooms. Those are the kids that get kicked out of school. And it was interesting that nobody really studied them because of their explosive outbursts. They get called aggressive, they get called learning disabled, they get called, you know, they get called oppositional, they get called a lot of stuff like that. But focusing on those outbursts, I thought was an important thing. And I was able to do it because of the staff support that I got. So that was my interest, and that's what I was able to do. I had a really good crew of people. We wrote a bunch of papers, and I think Monpreet and Rob Altoff were my sidekicks, basically. Jack McClellan. I think we did some important things. I was helping myself as much as anything because let's face it, we were all stuck at home and we were looking for ways to connect, to talk to people, to sort of feel like we were still alive and out and doing something. And I think the first one that we did was talking about telehealth, telemedicine, because that's what we suddenly were doing. And so I had it in my mind to interview somebody who was an expert on it. And I'm blanking on the guy's name. He was from Hawaii and he's written a lot about it. And so I thought, well, you know, if I want to know about this, chances are the members did too. So I asked the staff about it, and they said, yeah, it sounds like it's worth trying. And so we did it, and apparently it got some, you know, notice. And so basically, we worked on doing one, I think, every other week. And I would ask somebody who I thought had something interesting to share. And it was something that interested me, though I did reach out to other people and say, were there things that they would like to have us talk about? It was a lot of fun to do. And I frankly miss doing it. I think it pandered to my theatrical nature. You know, sort of coming off of the screenside chats, I think what marks us as a profession is, I'd like to think of what marks us as a profession is communication. And I can't say that this is done deliberately. It is done because I know some of my own shortcomings. Many times other people know a lot more than I do. And so I have found that I can make myself be much more effective if I know how to um, get the other people that I'm working with to give me their ideas or to, you know, feel engaged in whatever the um, project happens to be. And I know when somebody does that with me, I feel good about it. I feel like, oh, you know, that person respects me. They think I have a brain, you know, I'll work harder for that person as opposed to somebody who's basically trying to get the limelight for themselves. So I don't know that that's a great strategy. I don't think of it as I don't get up in the morning and say, oh, I think I will do that. I just do it because many times I don't know what I'm talking about, and other people at the table do. And I think it benefits everybody if they can speak up. When I started my internship, and again, this is straight medicine internship, they didn't know what to do with me, Cheryl, because all of the whites were pants. And they scrambled around and they found a skirt. And if I told you I looked like I could sit on an organ grinder's shoulder, I kid you not. I mean, it was really pretty pathetic how I looked. And I could sew in those days. I probably still can. I just haven't in a long time. But anyway, so I sewed and I made my own skirts and jackets, whites. So I would look like a human being. Um, I had a really good bunch of guys that I worked with. Again, they were very supportive, very helpful. Um, but there were some interesting things that came up. Um, I because they didn't have any women there. There was no particular dress code, and except to wear whites. And so I used to wear very colored stockings, pink and green and blue and turquoise. Um, and one night, we had a woman come in late at night, quite ill, and I took care of her. And the next morning, the attending came in and was really angry, saying, how dare you not take care of Mrs. Jones or whatever her name was, and so forth. And I said, what do you mean? I absolutely took care of her. She said she never saw the doctor. And I said, well, let's go in there together and see why she doesn't remember me. I thought I was pretty memorable. And I went in there. I think I had shocking pink stockings on at the time. And she said, yes, yes, so she was there, but I thought she was a nurse. And I said, when in your life have you ever seen a nurse in pink stockings? And everybody laughed, and that was that. Those were those were not major hurdles. And so I have to tell you, I was very lucky in medical school. There were only five of us in medical school, five women in medical school. Um, I, I said the internship and that whole house staff, I was the only woman. I was the first woman clinical associate at NIMH. Um, and I don't think it comes close to the kinds of experience that people of color have had, but I expect that there have been venues that you have been in where you can look back at it and say, yeah, I was treated well. I was treated with respect. I was treated kindly. Um, I had that experience almost until my first job. And the first job I had was a bit of a rude awakening. Um, but for the most part, having been a woman in medicine was not as bad as some people have experienced. There were, let's see, there were seven of us. Well, actually, there were 14 of us. There was seven. We swapped between rotations, and I think there were three women. Um, and they were both older than I was, not that much older, but they were in their 30s at the time I was in my 20s. So I was not unique there. And then in my fellowship, there were seven of us there, just total of seven of us there. And there were three women, one black woman. And so in those venues, women were not, and we're still minority, but not a big minority. My husband, I don't know that he helped me specifically engage in child psychiatry, but he has certainly been the wind beneath my wings. I think when you're um, married to a professional person, each of you has to give a little. Um, you know, it, there are times when your move is because of your partner, and there are times the moves are because of you. And I think navigating that dance is really important to people in general. I mean, I think relationships are important in general. And so whether you have children or you don't have children or whatever, I think most people have a significant other that they relate to. And you have to be prepared to um, sacrifice some things to that person, and that person has to be prepared to sacrifice some things to you. And I know I would be nowhere without that with my husband. For 6 months, so when my first son was born, um, I took off completely 6 months. And speaking of my husband, he came home one day a week so I wouldn't go stark raving mad. Um, and then after the 6 months, um, let me see, I covered, so Dennis Cantwell, who you're probably too young to know, but anyway, Denny was the training director at UCLA, a really charismatic training director. And boy, when those trainees found out that he was on sabbatical and they were stuck with me, they were not necessarily nice. But we got through it. And that was a half-time job. And then Peter Tanguay, who was also had a position at UCLA, he took a sabbatical, and I did part of his job for a while. And when I came back, um, I was able to um, do the, well, no, let me think. I did the fellowship first, actually, the research fellowship first, which is why I had something to write papers about while I was working part-time. And then I came back to be on the faculty and ran the inpatient unit at UCLA. And that we did full-time until my second son was born. And then by that time, I had reliable care, child care. Obviously, another obstacle you have to overcome. And I had good child care at that point, but I still wanted to be home with my second son to some extent. So I worked 4 days a week. And I remember selling my boss, Jim Simmons, at the time, saying, I'd like to keep my job, Jim. No, sorry, it wasn't Jim at the time. I'd like to keep my job, Dr. Simmons, but I'd like to do it 4 days a week. And I'd like to leave at 4 o'clock. Why should I pay you to do that? Blah, blah, blah. Everybody else works full time, blah, blah, blah. So I said, because quite frankly, I will do the job better than anybody else you're going to hire for that period of time. And you're lucky that I still want to do it. And he laughed because he was a good guy. And he laughed and he said, you're right. And so go ahead. So that was how we did that. And the only thing that leaps to my mind at the moment that comes close to that was when the man who hired me here at Stony Brook left. I was asked if I would be the interim chair. And I declined that. I was still building the division. And so I said to the dean, if you hire somebody half-time to do the child psychiatry piece so that I could do the interim chair pieces, I'll do it, but otherwise, I'd really rather not. And he said, well, I'd really rather not hire somebody part-time to do the child psychiatry piece. So that's what we did. He never held it against me, and we had somebody come in and be the interim and ultimately real chair. And I think that was a wise move on my part. There you are. It's sort of like you got your house half built and somebody asks you to move into their house. And what are you going to do about your house? I mean, I need a house to move into when this is over, and it won't be built if we don't have somebody building it, right? So that was kind of how I felt about it. That has to do with actually job searches. I thought the question about, is there anything that you would have done differently? So the first job I ever took, I took without looking at any other jobs. It was my husband's move. He wanted to move to Missouri. And I figured, okay, if he wants to move to Missouri, we move to Missouri and I'll take a job at the university there. And some people I knew, vouched for it. And so I did it. That was not smart. That's like marrying the first person that you date. And so, the second time around, when I was looking for a job, I looked at just about everything. I figured before, when I didn't do that, I didn't want to be, I didn't want people to think I was leading them on. I'm too direct for that. So I didn't want to do that. But then the second time I did, I said, you know what? I've got to look out for numero uno here. And I need to take a look at the kinds of jobs that there are out there, how people have problem solved their various jobs. So even if I didn't particularly want to move to, I don't know, Snakes Navel, Wyoming, the fact is they would have something to teach me about management and running a division and doing the next stage. And I was assured that everybody knows that not everybody who interviews at a job is going to take it. So I didn't have to feel like I was being a loss leader for somebody. So I think that that's really important for people to hear when they're looking for a job, that they're looking for a job, they're looking for a boss that's going to give them a hand up rather than stomp on their hand as they climb the ladder. And that they should look at whatever position they take as a learning experience. I don't know how to answer that question. You know, I don't do yoga. I'm having some back issues at the moment, but when I don't have those, I like to walk, I like to cook, I like to sleep, I like to read books. Um, I like my husband and my kids. Um, I think those are all things that you need to keep you well, but I'm not sure I look at them as wellness activities. You know, back when I was an intern, you worked your behind off.
Yes.
And you were on 24, off 24 when you were in the emergency room. Um, you didn't get paid very much. It was just what was expected of you. And to circle back to the woman physician business, I sort of felt like I was being the standard bearer for our gender. I better do a good job or they'll never accept another woman again. I don't know if you ever felt that burden, but I thought that was a significant responsibility. I think the same thing that was when I got into the business, that we're the we're the thought leaders here, that we're the people that know how to interview kids and parents. We know how to put information together from multiple sources like schools and pediatricians and the gardener if you have to. That's the fun of our job. That's the fun of it, orchestrating it, getting the expertise of the speech pathologist or the um, music therapist or whoever it is that's helping you fill in the picture so that you can understand that particular child. And I don't see how you do that in a slam bam, thank you, ma'am kind of way. I really would like to I would like to make sure that training is given all the time that it needs and that the faculty honestly is given the time they need as well. I think, you talk about wellness. I think we need to be nurtured as well, especially the young faculty. They're not very ripe fruit themselves. They've just finished their training by a year or two, right? So I think we have to take good care of them.